You know that feeling, don't you? That little something in your body that just seems off. Maybe it's a new ache, a change in how you feel after eating, or something else entirely. You mention it to a friend, a family member, maybe even your doctor, and you hear that all too familiar phrase, "Oh, that's just age." It's frustrating. Isn't it like your concerns are being waved away simply because you've lived a few decades? It makes you wonder if you're just imagining things, or if this is truly the beginning of some scary decline. That feeling of being dismissed, of not having your body's subtle whispers taken seriously, can be incredibly isolating and even frightening. It makes you question every little symptom, every change you notice, wondering if it's just you, or if something is genuinely wrong. The painful reality is that many of the things we experience as we get older get lumped under this vast, unhelpful umbrella of just age. But what if some of those changes aren't just an inevitable slide downwards? What if they are specific, often manageable symptoms that no one really takes the time to talk about? Or even worse, that healthcare professionals don't always have the time to delve into during a quick appointment. These aren't necessarily signs that you're dying, or that something catastrophic is happening right away. They're often just changes, but understanding what they are, why they might be happening, and what you can potentially do about them can shift your perspective entirely. It can move you from a place of worry and passive acceptance to one of understanding and empowered action. In this video, we're going to gently explore 4 of these common aging symptoms that people often experience but rarely discuss openly. They can be a bit embarrassing, a bit confusing, or just seem too minor to bother anyone with, but acknowledging them is the first step to feeling better. We'll talk about what they feel like, why they might be happening in simple terms, and some practical things you can consider trying or discussing with your doctor. It's about shedding light on these quiet changes and giving you some tools and reassurance, and make sure you watch all the way to the end, because there's something I want to share that I think will truly surprise and empower you about your own body and this stage of life. So, let's start with the first of these changes that often gets written off as just a normal part of getting older, but can significantly impact your comfort and sleep. And that's those persistent shifts in your bladder habits. Maybe you've noticed you have to go more frequently during the day, or perhaps the urge comes on suddenly, leaving you scrambling. Or maybe, and this is incredibly common but rarely talked about with frankness, you find yourself getting up multiple times during the night to use the bathroom. For some people, it's just once. But for others, it can be 3, 4, or even more times, completely disrupting restful sleep night after night. This isn't just a mild inconvenience. Chronic sleep deprivation from getting up repeatedly can impact your energy levels, your mood, your concentration, and your overall health. It can feel like your bladder is ruling your life, planning outings around known bathroom locations, or dreading bedtime because you know what the night holds. It can also lead to anxiety about accidents, making you hesitant to be far from home or comfortable places. When you mention this to someone, the typical response is often, "Yep, that happens when you get older." And while it's true that changes occur with age, dismissing it entirely means missing opportunities to understand and potentially manage it. What's happening? Well, several things can contribute. The bladder muscle itself can become less elastic, meaning it can't hold as much urine as it used to before sending the signal that it's full. The muscles around the bladder and pelvic floor can weaken, impacting control. In men, an enlarged prostate is a very common culprit, pressing on the urethra and bladder, leading to frequent urges and difficulty emptying completely. For women, changes after childbirth or menopause can affect pelvic floor strength and bladder support. There can also be changes in hormone levels that influence bladder function. Beyond these physical changes, certain medical conditions like diabetes, kidney issues, or even neurological conditions can play a role. And sometimes, it's simply related to lifestyle or other seemingly unrelated issues. It's not just about the physical structure, though. Your body's hydration and what you drink can have a huge impact. Drinking a lot of fluids right before bed is an obvious one, but certain drinks are notorious bladder irritants. Caffeine found in coffee, tea, and some sodas, as well as alcohol. can increase urine production and stimulate the bladder muscle, leading to more frequent trips. Artificial sweeteners can also irritate the bladder lining for some people. Even highly acidic foods like citrus, fruits, or tomatoes can sometimes contribute to bladder sensitivity. And it's not just about what goes in. Constipation, which also becomes more common with age, can put pressure on the bladder, making it feel fuller than it is and increasing urgency. Stress and anxiety can also worsen bladder symptoms, creating a vicious cycle where worrying about needing the bathroom actually makes you need the bathroom more. So, what can you actually do about this beyond just accepting it first? It's crucial to talk to a doctor. While often dismissed, these symptoms can sometimes point to underlying issues that need medical attention, like infections, kidney problems, or prostate issues. Don't just assume it's age. Describe exactly what's happening, how often you go, when the urges happen, if there's any pain or discomfort, how much it's affecting your sleep. Be specific. Beyond medical evaluation, there are practical things you can try. One is timing your fluid intake. Make sure you're still drinking enough throughout the day. Dehydration can actually concentrate urine and irritate the bladder, but try to front-load your drinking earlier in the day and taper off in the evenings. Avoid large amounts of fluid in the few hours before bed. Another strategy is to be mindful of those bladder irritants we talked about. Try reducing or eliminating caffeine and alcohol, especially later in the day, and see if it makes a difference. It might take a week or two to notice a change. Pelvic floor exercises, often called Kegels, aren't just for women. Men can benefit too. Strengthening these muscles can help improve bladder control. A physical therapist specializing in pelvic health can be incredibly helpful in teaching you the correct technique. Bladder training is another technique where you gradually increase the time between bathroom visits to help your bladder hold more urine. This takes patience and consistency, but can be very effective. Managing constipation through diet, more fiber, and hydration can also relieve pressure on the bladder. And don't underestimate the power of relaxation techniques or stress management. Sometimes, calming the nervous system can help calm an overactive bladder. It's about exploring these different avenues and seeing what works for you, rather than just resigning yourself to a life of constant bathroom trips and interrupted sleep. These are real, physical issues with physiological causes, and there are often steps you can take to improve things. Now that we've gently explored those often disruptive changes in bladder habits and how much more there is to it than just getting older, let's transition to another subtle shift that many people experience but rarely discuss, and that's changes in how things taste and smell. Have you ever noticed that your favorite food just doesn't taste quite the same anymore? Or maybe smells aren't as strong, or they seem distorted. This can be incredibly disheartening. Enjoying a meal is one of life's simple pleasures, a social activity, a source of comfort. When taste and smell diminish or change, food can become bland, unappealing, or even taste unpleasant. This can lead to a loss of appetite, weight loss or gain. Sometimes, people add too much salt or sugar to compensate, and even nutritional deficiencies if you're not enjoying food and not eating a varied diet. It can also impact safety, making it harder to detect spoiled food or dangerous smells like gas, like bladder changes. A change in taste and smell is often vaguely attributed to just getting older. It's true that the number of taste buds decreases slightly with age, and nerve sensitivity can change. However, this is usually a gradual, minor shift, not a sudden or significant loss. More often, changes in taste and smell are linked to other factors that are more prevalent as we age. Medications are a huge culprit. Older adults often take multiple prescriptions for various conditions, and many medications list changes in taste or smell as a potential side effect. This can include medications for blood pressure, cholesterol, depression, thyroid issues, and many others. Dry mouth, which we'll talk about more in a moment, also significantly impacts taste because saliva is needed to dissolve food chemicals, so taste buds can detect them. Dental health plays a role. Poor oral hygiene, gum disease, or ill-fitting dentures can all affect taste. Respiratory issues like chronic sinus infections, nasal polyps, allergies, Or even just a persistent cold can block nasal passages and affect smell, which is intricately linked to taste. Head injuries, even mild ones from years ago, can sometimes impact these senses. Certain medical conditions like diabetes, Parkinson's disease, or even nutrient deficiencies like zinc or vitamin B12 can sometimes manifest as changes in taste or smell. Even exposure to certain environmental chemicals or smoking or a history of smoking can have a long-term impact. The point is, it's rarely just age in isolation. It's often age combined with other factors that are common in later life. So, if you're noticing these changes, what can you do first and foremost? Discuss it with your doctor and pharmacist. Review all the medications you're taking, both prescription and over-the-counter, including supplements. Sometimes, a different medication or adjusting the dose might help. But never stop or change medication without consulting your doctor. Improve your oral hygiene. Brush and floss regularly. See your dentist and address any dental issues. If you have dry mouth, addressing that can also help, and we'll cover how in a moment. If you suspect sinus issues or allergies, talk to your doctor about potential treatments. For those whose taste has diminished, try experimenting with different flavorings that don't rely on just salt or sugar. Herbs, spices, lemon juice, vinegars, garlic. An onion can add depth and aroma to food. Focusing on textures and colors in your meals can also make eating more enjoyable, even if taste is altered. Pay attention to the aroma of food while cooking. Smell accounts for about 80% of what we perceive as taste. Simple things like ensuring your sense of smell is as clear as possible. Addressing congestion can make a big difference. Again, this isn't just something to accept. It's a signal that something has changed. And that change often has identifiable and sometimes addressable causes. Moving from the senses of taste and smell, let's talk about another set of sensations that can become bothersome and are frequently overlooked or dismissed. Chronic dry mouth and dry eyes. Do your eyes feel gritty, like there's sand in them? Or sting, especially by the end of the day? Do you wake up with your mouth feeling like cotton? Do you find yourself needing to sip water constantly? Or does food stick to your mouth? These might seem like minor annoyances individually, but combined, they can significantly impact your comfort and even your health. Chronic dry eyes can lead to blurry vision, light sensitivity, difficulty reading or driving, and even damage to the cornea if severe. Chronic dry mouth isn't just uncomfortable. Saliva is crucial for digesting food, protecting your teeth from decay, preventing infections, and enabling taste. Without enough saliva, you're at higher risk for cavities, gum disease, and oral infections, in addition to difficulty eating and speaking. Again, the easy answer is, it's just age. And it's true that tear and saliva production can decrease somewhat with age. But like taste and smell, other factors are usually the primary drivers. Medications are a massive contributor to both dry eyes and dry mouth. Antihistamines, decongestants, diuretics, medications for blood pressure, depression, anxiety, pain relievers. The list is long. If you're taking multiple medications, the likelihood of experiencing dryness increases. Medical conditions can also cause dryness, most notably Sjögren's syndrome, an autoimmune disorder that affects the glands that produce tears and saliva. But also conditions like diabetes, thyroid problems, or rheumatoid arthritis can be associated with dryness. Environmental factors play a huge role. Dry climates, wind, air conditioning, heating, and even prolonged screen time because you blink less can worsen dry eyes. Dehydration is another simple but often overlooked cause of both. Lifestyle factors like smoking or drinking alcohol can also exacerbate dryness. So, what steps can you take for dry eyes? Start with simple things. Use over-the-counter artificial tears regularly throughout the day, not just when your eyes feel dry. Preservative-free drops are often recommended if you use them frequently, as preservatives can sometimes irritate the eye. Try warm compresses on your eyelids to help stimulate oil glands that contribute to tear quality. Blink consciously, especially when reading or using screens. Consider using a humidifier in your home, particularly in your bedroom at night. Protect your eyes from wind and sun by wearing sunglasses outdoors. Avoid directing fans or air conditioning vents towards your face if these don't help, or if you experience pain, significant redness, or vision changes. See an eye doctor. They can perform tests to assess your tear production and suggest stronger prescription eye drops. Punctal plugs tiny inserts to keep tears in the eyes longer, or other treatments. For dry mouth, staying well hydrated by sipping water frequently throughout the day is key, but avoid sugary or acidic drinks. Chew sugar-free gum or suck on sugar-free candies. This stimulates saliva flow. Look for products specifically designed for dry mouth, rinses, sprays, or lozenges that contain ingredients like xylitol or artificial saliva. Avoid things that dry out your mouth further, like caffeine, alcohol, and tobacco. Using a humidifier at night can also help. Pay extra attention to your oral hygiene, brushing and flossing diligently, and see your dentist regularly, informing them about your dry mouth so they can help monitor for cavities and infections. Again, review your medications with your doctor or pharmacist to see if any of them might be the cause. Sometimes there are alternative medications with fewer drying side effects. Dry eyes and dry mouth are not just minor discomforts you have to live with. They are symptoms that often have treatable causes. And addressing them can significantly improve your quality of life and prevent more serious issues down the road. Finally, let's turn to a physical symptom that many people notice as they age, and while not entirely unspoken. The ease with which it happens and what it might indicate is often brushed aside: increased bruising and thinning. Easily damaged skin. Have you noticed that even a minor bump against a doorframe or a piece of furniture leaves a significant bruise? Or perhaps your skin seems more fragile, tearing or scraping more easily than it used to. This can be alarming, making you feel vulnerable and worried about potential injuries. You might find yourself covered in bruises you don't even remember getting, leading to questions from others or self-consciousness. The common explanation is that skin thins with age. And yes, that's true. As we get older, our bodies produce less collagen and elastin, the proteins that give skin its structure and elasticity. The fatty layer beneath the skin also diminishes, making the skin less cushioned and the blood vessels closer to the surface. These blood vessels themselves become more fragile over time. So, yes, the skin is thinner and less resilient. However, like the other symptoms we've discussed, there are often contributing factors beyond just the passage of years. Medications are again a significant culprit. Blood thinners like aspirin, warfarin, or newer anticoagulants, as well as corticosteroids taken orally or used in topical creams, can increase bruising by affecting blood clotting or thinning the skin. Long-term sun exposure over a lifetime significantly damages collagen and elastin, accelerating skin thinning and fragility, particularly in sun-exposed areas like the arms and hands. Nutritional deficiencies, while less common with a balanced diet, can sometimes play a role. For instance, deficiencies in vitamin C or vitamin K can impact blood vessel health and clotting. Certain medical conditions affecting blood clotting or connective tissue can also contribute, although these are less likely to be dismissed as just age. So, what can you do about skin that bruises and tears easily? Protecting your skin is paramount. Be mindful of potential bumps and scrapes, perhaps wearing long sleeves or trousers when doing activities where you might injure yourself. Keep your skin well moisturized, while moisturizer won't thicken the skin. It can improve its barrier function and flexibility, making it slightly more resilient and preventing dryness, which can exacerbate fragility. Choose gentle soaps and avoid excessively hot water, as these can strip the skin of its natural oils. Review your medications with your doctor. If you are on blood thinners, understand that increased bruising is a known side effect, but always take them as prescribed. If you use topical steroid creams regularly, discuss this with your doctor, as long-term use can thin the skin. Ensure your diet is providing adequate nutrients, particularly vitamin C, which is essential for collagen production, and vitamin K, which is important for blood clotting. While you can't reverse age-related skin thinning completely, minimizing other contributing factors can make a difference in reducing bruising and tearing. Again, if you notice sudden, unexplained, or severe bruising, especially in areas not prone to bumps, or if it's accompanied by other unusual symptoms, It's always wise to consult your doctor to rule out other potential causes. We've talked about those persistent bladder changes that keep you up at night, the frustrating shifts in how food tastes, the uncomfortable dryness in your eyes and mouth, and skin that seems to bruise at the slightest touch. These are just 4 examples of the many subtle, often dismissed changes people experience as they get older. The key takeaway here isn't to panic about every little twinge or change you notice. It's to recognize that your body is always communicating with you. And while some things are simply part of the natural process of aging, many symptoms that get filed under just age actually have specific, identifiable causes that are often related to medications, lifestyle factors, nutrition, or other very common and often manageable conditions. The surprising truth I mentioned at the beginning isn't some hidden cure or secret pill. It's the power that comes from simply knowing that these symptoms are common, that you're not alone in experiencing them, and most importantly, knowing that they are often not just inevitable decline, but signals that you can investigate. It's the power of not accepting just age as a full explanation when something feels off. It's the power of feeling empowered to discuss these things openly with your doctor, armed with the understanding that there might be actionable steps you can take, whether it's timing your water intake, reviewing your medication list, boosting your oral hygiene, protecting your skin, or exploring dietary changes. Small, informed actions can often lead to significant improvements in your comfort and quality of life. Remember, your body is resilient, and you are still in the driver's seat. Aging brings changes, yes, but it also brings wisdom and the opportunity to approach your health proactively. Don't be afraid to talk about these unspoken symptoms. Bring them up with your doctor, even if you've been dismissed before. Seek out specialists if needed, urologists for bladder issues, ENTs for taste, shirk smell, ophthalmologists for eyes, dentists for dry mouth, dermatologists for skin. Trust your gut instinct when something doesn't feel right. These aren't signs of you dying. They are often just signals that require a little attention, a little understanding, and sometimes a simple adjustment or treatment. Small changes can make a big difference to your health and happiness. I truly hope this conversation has shed some light on these often overlooked symptoms and made you feel a little more empowered and a little less alone. What about you? Have you experienced any of these symptoms, or others that you feel get dismissed as just age? Share your thoughts and experiences in the comments below. Your story might help someone else feel understood. If you found this video helpful or reassuring, please give it a like. It helps us reach more people who might need to hear this message. And if you haven't already, subscribe to the channel and hit the notification bell so you don't miss future videos where we explore health and living well at every stage of life. Thank you for spending this time with me. Remember, you deserve to feel comfortable and heard in your own body. Live your best life at every age.